Carpal tunnel syndrome is compression of one of the major nerves of the upper extremity at the wrist. So there are several important nerves that come down from the neck and they travel down the arms in a predictable pattern. Those nerves can be compressed at any way along their highway as they come down into the hand and the wrist. One of those nerves is called the median nerve. Now the median nerve travels down the arm and then it goes through a carpal tunnel, which is an anatomic area defined at the wrist right around here. In certain situations, it could be trauma, it could be from inflammation, it could be from some repetitive injury. The nerve can get very inflamed and the space where it travels here at the wrist can be compromised. The ligaments covering the nerve can thicken, and overall there can be fluid and swelling in the area that can decrease the space available for the nerve as it travels through that tunnel in the wrist. Now when the nerve gets compressed at the wrist, the most common symptom initially is numbness and tingling in the fingers. Now I've seen patients with numbness and tingling in all fingers when they have carpal tunnel syndrome, but typically it only affects these three: the thumb, the index finger, and the middle finger. And that's because those are the main digits that the median nerve gives sensation to. When you have carpal tunnel syndrome, when the nerve is compressed at the wrist, you can also have some pain or discomfort at the wrist and also radiating into the hand. Often patients will complain of a dull ache in these muscles here at the base of the thumb, and sometimes radiating across the wrist or down into the fingers. If the nerve is extra sensitive, you can feel electricity-like symptoms, some electric bolts or tingling shooting down the fingers and also up into the arm. Now when this occurs, it's very important for us to do a detailed physical exam and really isolate where the problem is coming from. Because even though the symptoms may seem like carpal tunnel syndrome, and you may have all the classic signs with the numbness and the tingling and the pain at the wrist, it's also possible that the nerve is compromised higher up, somewhere along its highway. Most commonly, we see it at the neck. You can have a pinched nerve at the neck, and that can be the same nerve that eventually travels down and becomes the median nerve at the wrist. We usually just determine the difference between a pinched nerve at the neck or at the wrist with a detailed physical exam in the office. Sometimes